www.healthcmi.com, acupuncture continuing education online. Today, acupuncture with drug therapy relieves depression. Researchers conclude that acupuncture increases the total effective rate of the drug paroxetine for the relief of mild to moderate depression. In this research at healthcmi.com, we find that acupuncture mitigates the adverse effects caused by drug therapy and increases the efficaciousness. In this case, it was paroxetine, an SSRI, which is a selective serotonin reuptake inhibitor, also known by the name Paxil, for example. In this case, people taking Paxil did not do as well as people who took Paxil and also had acupuncture therapy. In other words, they had less depression as a result of combining the therapies. In addition, less side effects from the drug. You can go to healthcmi.com, click on News, and the article entitled Acupuncture with Drug Therapy Depression Relief Confirmed on July 19, 2018 has the entire details of the research. Everything's footnoted so you can see the original sources, and the team of translators and researchers at healthcmi.com have presented this for you. I hope you like this because mental health issues are enormous worldwide, and anything that can help people is a step forward. In this case, we find that acupuncture combined with drug therapy is better than drug monotherapy. There are also some standalone, in other words, acupuncture as a monotherapy also has some efficaciousness for depression. Naturally, there is no one cure for depression, but we now find that acupuncture is one helpful step towards helping those fighting mental illness. The study design is revealed. They show how it's done, all the stats going in and out, this type of thing. And importantly, for licensed acupuncturists, there's a close look at the acupuncture points used in the study, featuring governing vessel 20 by Hui, Yin Tang, the classic point in the glabella, governing vessel 16 Feng Fu, GB20 Feng Shi, Da Zoi, governing vessel 14, PC6 Naguan, and spleen 6. And there's some other points added for specifics. So based on differential diagnostic considerations, some variations were allowed in the study. And this is typical. In some studies, it's only a certain acupuncture point or set of points is allowed for all patients to eliminate variables, but that really doesn't mimic what someone would see in an actual acupuncture clinic where the treatment is literally customized to the patient's individual needs. So here, certain points were allowed for specific conditions. For example, for patients with liver qi stagnation, liver 3 and Tai Chang, and large intestine 4, Hegu were allowed. Now, liver qi stagnation translated into kind of a Western idea, we might say something like more stress and more anxiety. For patients with qi depression transforming into fire, liver 2 and GB43. And for patients with anxiety and depression damaging the spirit, Anmian and Shenmen, Heart 7 were allowed, and so on. So it is a great detail for clinicians to see what the research supports, and I encourage everyone to take a look. For people who are interested in acupuncture therapy for the treatment of depression for themselves, we encourage at the Healthcare Medicine Institute people to contact local licensed acupuncturists to learn more. I'm Adam White, licensed acupuncturist for the Healthcare Medicine Institute. Thank you for listening. www.healthcmi.com